Good morning, good afternoon, good evening, everyone. You are welcome to today's episode of Public Health in Real Life, a channel where we hope to inspire the next generation of public health leaders, celebrate unsung heroes, and shed a light on prevailing global health issues. We have an exciting episode for you today, and I'll be presenting my co host to talk more about our speaker and the topic for today. Over to you, Ashwin.
Thank you so much, Maimuna. I agree. We have an exciting topic today and an amazing guest with us today. I'm Ashwin Kadambi. I'm a senior global public health professional. And in today's program, we are talking about preparing children for surgery and anesthesia using web-based technology. With us is Dr. Gunilla Lööf, who is a Sweden-based pediatric CRNA, which stands for Certified Registered Nurse Anesthetist, who has been working at the pediatric section of the Karolinska University Hospital in Stockholm, Sweden for over 25 years. She has traveled around the globe providing life-saving surgery to hundreds of thousands of children. Gunilla is the founder of the worldwide used website anesthesiaweb.org. That is anesthesia with an A, and the description has the link to the website. So through this website, they provide information and preparation for children and caregivers prior to hospitalization, anesthesia, and surgery. Gunilla has a PhD from the Karolinska Institute in web-based preparation and learning for children in the context of healthcare. So we are thoroughly excited about today's program and to learn the ways we need to prepare children before these surgeries to ensure their fear and anxiety is lessened, and they also appreciate healthcare and health services in the long term. So without any further ado, let me turn to Dr. Gunilla Lööf.
Hi, everyone. I don't know how many we are there out there listening, but wherever you are, welcome. And thank you for inviting me to talk about a topic which is really close to my heart. And it's about web-based preparation for children and young people prior to hospitalization, anesthesia, and surgery. Now we are going to test the technique here.
Yep, we are live.
You see me? You see the presentation?
Yep, we see the presentation.
So, as Ashwin said, I've been working very, very many years as a pediatric nurse and a pediatric nurse anesthetist at the Karolinska University Hospital at the pediatric section. And that's the biggest hospital in Stockholm, in Sweden. I have also worked 7 years with Operation Smile, a fantastic organization helping kids all over the world who are born with cleft lip palate. But now I'm going to talk to another project I have worked with many years. And it started many, many years ago, because when I was a little girl, I ran away from my own operation. My mother, she found me by our car in the parking lot, too embarrassed over my behavior to take me back into the hospital. So we went home without having any surgery done. The plan was for a quite quick and fairly simple procedure, but no one had prepared me for what was to come. Still, I can remember how scared I was for needles, strangers, pain, anesthesia, and death. Because death, that was exactly what had happened to my grandmother some months before when she was hospitalized. Being brought there to the hospital, I was certain the same would happen also to me. As a little girl, how would I have understood better? Working as a pediatric nurse anesthetist, meeting worried children and families easily takes me back to recall the feelings of panic and fear. And as an adult, I also can reflect over the unfortunate consequences these experiences had for my relationship with the healthcare during my entire childhood. But what is most important is that I can also remember the relief and confidence I felt when I finally met healthcare providers who respected my fears and in an understandable way informed me and prepared me for expected medical procedures. Although many years has passed by since my own experience, children all over the world daily continue to arrive to hospitals scared and unprepared. For most healthcare providers, the entrance to the perioperative environment or to the hospital is the entrance to another day at work. But for children and their families, the perioperative period is a significant and stressful experience which will be remembered for the rest of their lives. Pre-operative anxiety, it is a common and well-described phenomenon affecting up to 60% of children undergoing perioperative procedures. In terms of impact, preoperative anxiety affects the child negatively, both in the short term during the early postoperative phase and with delayed and long-term consequences. Even though the frequency of the negative behaviors for most children is limited and decreases with time, we can see that many are suffering for a too long period. And sometimes the reactions are unexpected and very, very difficult to interpret. The fact that the reactions come at some point and in some form is far more common than we think. A child in a hospital means a hospitalized family. Parents also experience significant distress during their child's hospitalization, and the child's anxiety and negative outcomes are strongly related to their parents' condition. Unfortunately, I would say, lack of information, preparation, and understanding is a significant cause of both children and relative stress and anxiety during a hospitalization. Children have their own individual experience of hospitalization, anesthesia, and surgery. They have a lot of questions. They want to be prepared if you ask them, and they want to be involved in relation to their preparational needs. Preparation of children and parents for perioperative procedures is also recognized as crucial to decrease this distress and anxiety, improve cooperation and participation, and to reduce these short and long-term negative consequences I just talked about. Today, there is a growing international recognition that children have the rights to participate in matters affecting their lives. And access to understandable preparation is an important part of children's participation, also recognized as a fundamental and legal right for children in the medical context. There is also an increasing awareness that children's perspectives differ from adults, making adults acting as proxies for children. This is totally insufficient. A child perspective is based on external views of children's experiences. But the child's perspective means that we are listening to and considering children's voices and experiences. And despite loads of evidence highlighting the importance of including children's perspectives, their right to and need for preparation, children's views of the perioperative care are rarely sought. No, this is usually described from the healthcare providers and parents' belief about children's understanding and what kind of preparation they need. So, during the last 20 years, I have worked to change this. I want to see my daily work from children's perspectives And together with children in different ages and with different medical experiences of healthcare, develop understandable preparations programs aimed to reduce this stress and anxiety and to reduce the negative consequences. And as the time went by, I also learned that the limited time healthcare providers spend with the families before anesthesia and surgery implies that alternatives are needed to secure adequate preparation. Most children over the world have the unique experience of, at least at some level, being surrounded with web-based technology from birth. And here you can see some number, and the numbers comes from my country, Sweden. Children start using digital media notably earlier today, and the proportion who use it daily increases with age. 26% of infants under 12 months of age and 37% of the 1-year-olds have already encountered the internet at some point in their lives. 2-year-olds use the internet today to the same extent as the 4-year-old did for 4 years ago. And you can see the numbers here of the daily use of internet in children. Of course, I understand that you can have different options about that. That's the same for me. I can have thoughts about that. But one thing is for sure, we will neither be able to reverse nor change this development. So if we want to reach children and young people with our message, we must be where they are. And where are they? Yes, they are here. That's on internet. Children of today seek information, they play and learn. And if you ask children, they also declare the internet as the primary source of information ahead of contact with healthcare. They want to be prepared on the web prior to their hospitalization. We also know that web-based preparation gives a significant increase in knowledge and understanding, both in children and parents, if you compare, to example, information given with conventional brochure material. Yes, increasing use of web-based technology provides almost unlimited opportunities for development of preparation programs. But we have to be careful, for this is not about just developing any website. We have all the opportunities in the world, but we have to think. This is about reaching children in a very vulnerable situation when they are sick, scared, and maybe are about to be involved in something very unpleasant and scary. In order to not just be just another website in the line of an endless supply, high demands are placed on the content, design, and medical quality assurance of the information conveyed. The website also must be designed to reach children of all ages and developmental stages, content-wise, technically, pedagogically, and by language. We also have to reach children with different pre-understanding. And when I say pre-understanding, I'm not only talking about pre-understanding in terms of age and cognitive development. I'm thinking pre-understanding very much about what kind of previous medical experiences the child have. The aim of web-based preparation is never ever to replace, but to support children's preparation, learning process, and contact with the healthcare providers. Because if the child already has started to prepare on the web, when the children arrive to the hospital, we will have more time available for the individual interactions because the preparation has already started. So my task when I meet the children in the hospital who are prepared on web is first to calibrate what preparation they have received. Second, what they have understood. And third, from there, continue the process of making question mark to exclamation mark. I also think I know that we have to remember that information and preparation is not a one-time event which can be marked as checked, done. No, it's an ongoing process that must be both adapted and repeated as the child grows and matures. So to conclude, never forget every child's right to information and preparation in an understandable way, regardless of where in the world they live, in what healthcare system they are included, or to what hospital they are admitted. And I think here, web-based preparation programs, including children's perspectives, constitute a very new important resource to be used all over the world. The web is there, it's cheap, and wherever we are in the world, most people have a mobile phone. So it's just start using it. And as an example, as we said, you see the logo in the left lower corner, anestesiaweb.org. And the Anesthesia web, I'm going to say a bit short about that. The Anesthesia web has been available since 2006 and is now an established part of the Swedish pediatric care and, as I said, the Nordic pediatric care. In addition, we have visitors from 120 different countries monthly. So what we were lucky to do last month, we launched a new version, which I will see if I can show a bit, but I will ask you all to go into anesthesiaweb.org and check. But wait, give me a minute. See if it works.
Yeah. You can just
Yeah, I have it. Yeah. So, can you see it, everyone? I can't hear anyone, so I think you said yes. And here is the Anesthesia web.
Yeah, Gunilla, I think you have to reshare the just if you come back to on this software, you can just reshare. I think you
reshare.
Yeah, just share.
Oh yeah. Okay, I'll see if possible.
There we go. Yeah, I think.
You see it now?
Yep. You can go to the next.
It's fantastic that it works at all. So this is the Anesthesia web. And as you see, there are quite two parts of it. You see here, it's a small part for adults. And that's the meaning that adults, it's not the big part of the front side. No, this is for children. So here is the pediatric part, and here is for adults. But despite what I'm saying, I'm going to start with showing you the adults just quickly. So here you can, in the menu here, you can go in and see about different topics, information and preparation. You can see how you talk to children in different ages, what happens in different areas. You can read about pain and pain management. You can read about what to do when I come home. And I would like to say that all information in the Anesthesia web is created to be general. That means that we don't have any local tips or anything. The site can be used all over the world, independent of where the kid is going to be admitted for a hospitalization or anesthesia and surgery. So, and the fantastic thing I think here is that you see the English here. You can open this and you have information from parents in 32 different languages. And as I said, since pre-operative anxiety and fear is very, very much correlated to the parents' condition, it's very, very important that the parents are prepared in order to be able to support their kids. So please, when you have some time, go in and read more here. And then I just want to briefly look at the pediatric section. And this section is available in Swedish and English. So here, I'm just showing you, you open up some different rooms. And here is about hospital clowns. How show the kids in an easy and fun way, because this is going to be fun, because having fun is a big educational cornerstone to learn. And here you can learn about sleeping machine monitor, cardiac monitor, whatever. You see, it's a lot of things. And you can, here, you can follow other kids who have been in hospital. Here you can go in and build your own operating room. You can create your own bed. You can have green floor and flowering walls or whatever you like. And you can be the doctor. It's a playing room, like an anesthesia room. I'm just showing you some parts of it. And here we have a special section for the teenagers. You can see we have a different design, a little bit more cool one, not so many bright colors. And then you can go in here and read about preparations. It's a mix with a lot of photos. And I would like to say that all this information is available and it's free. You can just link it. We are not gonna have any money from it. It's free. We just want kids to be prepared. And all this information included on the Anesthesia web is created together with children in different ages and with different experiences and different sickness in the back package. So nothing is, we never pressed on the launched bottom until they say, yes, that's okay, that's quite cool. So I have worked with over 100 kids the last year to create all these things. So my role had more been like an advisor, but together, and that's where you learn how, because the children knows their perspectives best. And as an adult, you can't have a child's perspective. You can have a child perspective to want to know the best for a child, but to know exactly how a child feel and what they are afraid of and what they therefore want to know and how they want to be prepared. You have to include them and do the work together with them. So I just want to invite you all, if you don't have anything to do like a Saturday day like this, go in and check the Anesthesia web out. And please, if you can do anything for the world's kids, spread the message about the Anesthesia web, anesthesiaweb.org. I think I stopped there, Ashwin, and then we can continue with.
Wonderful. Thank you so much for that excellent presentation, Gunilla. It was there's a lot of resource, and you rightly highlighted the perspectives of children that must be incorporated when providing perioperative care. And my first question is related to parents. So how early should they get their children to use anesthesiaweb.org before the surgery?
I think it's totally dependent on the age of the child. And if you go into the parent sections, preparation, and then you choose I have a 3-year-old and a 4 or 5-year, it's because it's dependent on what kind of understanding they have of time. You know, if you have a small child, you can talk with them a month. If you have a 4-year, they don't have this perspective of time to talk with them a month ahead. But a teenager, you have to talk with them. So it's totally dependent on the age of the child. But if you want to have a tip, you can just check out the age of your child and then check what we recommend.
Okay.
But
okay.
Also, as I want to say that you know, when you come home, you have a lot of questions. So we recommend all children to also go in on the website when they come home. I used to say, can't you go in on the website and see if we did as they say we should do? So you can check us there. So they go in there, and it's like a kind of debriefing for them. And also, you know, if a kid run and broke their arm when they are in the daycare or in the school, you have a whole class affected of being afraid. So that's also a really good complement for the teachers. And a lot of teachers uses the website to learn about what happens in the hospital.
Yeah. And let me ask a twofold question is that in terms of implementing anesthesiaweb.org, what are some lessons that you learned and can share with young public health professionals who are trying to implement these kinds of interventions into their program? And also, if you can talk about some obstacles you faced, especially with perhaps childcare specialists who might be skeptical if this kind of a website will replace their career.
I start with the last thing you said, but which I said that this is not going to replace. But we know children need to hear the information many, many times. That's how children learn. We all know that you can read a book for a child hundreds of times, and every time it's like it's totally new book, because they need to hear it, and because they learning for a kid, it's a process. So we have to make like preparation materials which stimulates the process of learning. And that's why I said this is not going to replace anything, because they can start. The child life therapists, they are not at home and cannot be. And it's only good if the child has started to prepare at home, and we can continue when they come, because then we have saved a part of the journey to be prepared.
Right.
Because the worst thing we can do with kids is to not ask them, let them be prepared, or prepare them on the same morning. You're coming in 7:00 and you're going to be operated 7:45, and I want to prepare the kid and blah 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 blah. Then you can just don't do it, because it's too short time frame. Children needs time to process what they hear. So that's one thing. And but the problem, what I would think, I think a lesson is for me, I have been working 25 years with meeting children and parents. So, you have met thousands of families, but the ones from whom I learn most is the kids.
Yeah.
So if you want to learn what they are feeling about what we are doing to them, talk with them, ask them. And that's a strength in this program, I think, on the web, that we have done everything together with the kids.
Sure. And in terms of lessons learned for public health professionals from your, the kinds of steps you went through and obstacles you faced while trying to implement this at a systems level.
Yes. If you're going to build a thing like we have done, you need money, of course, because it's really expensive. If you're going to do a good thing, you're going to need money. And we were lucky to receive money from the Swedish government to do it. So it's not built by the hospital, it's on another level. But also you need to understand your competences, but also your lack of competence. You need to have a team. So we have a team of 10 people, except for the kids or the hundreds of kids, but the 10 people in the group, and we call the team for the dream team. And you need a copywriter, you need a UX designer, you need a programmer, you need a photographer. But you have to pick the right people to make a good team with the same goal. And the goal is to reduce the negative effects for children. Because as we saw, almost 10% of kids are suffering a year after hospitalization. And I think it's so sad, because this is not a rocket science. This is, for me, quite simple. But, sometimes the most simple thing is the most difficult to implement. And one obstacle, I think, it's to have healthcare providers to understand the importance of this evidence and this research. Because, information can easily be taken as something blah, 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 we don't have time, just take the kid. But if we think about it, what kind of long-term effects we give the kids, why can't it be important? If you have a new medicine coming out, everyone want to try it in 1 second because with it's evidence-based and blah, blah. Yeah, this is evidence-based. There's loads of evidence talking about the importance. So that's a big thing for me to implement the knowledge in healthcare providers all over the world.
Right.
That this is important and this can be easily done, and it's going to have big, it's going to have a big importance in a longer perspective, both in a short and a long perspective.
Got it. And how do we differentiate between a child who might have anxiety before the surgery versus anxiety as a disorder?
Yes, I think it's two totally different things. But pre-operative anxiety is a high level of fear, if we can say like that, an unnormal level of fear. And if you see that so many, if you ask children about, I have done that in another paper, about how do you feel when you are hospitalized, more than 80% describes that they are afraid and scared and stressed almost all the time in hospital. That's 8 of 10.
Yeah.
So, but we don't, when we come to the perioperative care, the anesthesia and surgery, we have a closed door. You have to dress to go into operating room. That's the same thing with the research. Right. You ask the medical doctor, the anesthesiologist to measure cortisol or blah, blah, blah as a level on fear and anxiety. And you ask the parents, how do you think your child were prepared? But you never ask the kids.
Right.
It's very, very seldom. And who is the one who described the feeling if it not won't be the one laying half naked on the operating table?
Right.
So we have to ask them. And I think if we don't ask them, we are never going to reach them. Because, and especially not on a website, if we don't if they don't like it, they know exactly how to shut the site down. And so you have, especially when you do web, that's a big competition you're in doing a website. So you have to... Right. We are too old doing it. We have to do it with the kids because the kids know what the target group are going to like or not like.
Yeah, so, that's really very interesting, Gunilla. And, to get a little bit more personal here, and to highlight your story about the child's perspective being different from an adult's perspective, both my child and I have had surgery. And my child said, "Oh, surgery was so cool. I want to have another one." And I was looking at him like, "Are you kidding?" So I definitely agree with that different perspective and, making sure that the child's voice is part of that whole process because they see things from a different perspective than we do. And it's interesting you say, with all of the surveys and all of that is asking from the parent's perspective, not necessarily the child's perspective. I do have some audience questions here that I want to get to, just so that, you can elaborate on those. You had mentioned, the different percentage of internet use, cell phone use, and all of that from like a Sweden or developed world perspective. Now, we do know that, a very significant of the population of the world is living in low and middle income countries where there's limited resources. Even though there's cell phone usage, maybe there's limited internet bandwidth. So one of our audience asked that, can all or most of these web resources be downloaded or saved for offline use?
Not everything, but for example, I'm echoing in my, but for example, no, not everything can be downloaded, but that could be because this can be done in the future. But and I know that internet is a problem, even though they have cell phones. Most people all over the world have cell phones. But I think in the future, we're going to see internet use because it's going to be built out. And we are talking about the future here. But also we have if we have some organization who wants to use some of our things, it's easily, we have a technical team, we can download it to be able to use. So everything is possible, and it can be adjusted to be able to use all over. And also many parts of the website we also have imprinted, like in cartoons, or it can be printed. And so that's not the limitation. Everything can be done from the website, from the content on the website.
Okay, that's great to know. And the follow-up question that closely ties with that also is, how do you implement this type of intervention? So outside of just from the internet perspective, how would you implement it in a resource-limited setting where maybe the OR room or the hospital or the facility is not even set up to have those different levels and steps of care that you've tested out with this model?
What do you mean with it? Don't have this kind of like internet settings? And
yes, so basically is, how would you implement this type of web-based technology in a resource limited setting so that you promote sustainable impact? Like, how would you launch this kind of initiative?
I would like to do it first. I would go there if I have a specific city or hospital or whatever. I would start with implementing the knowledge of preparing children, and also the knowledge and understanding of the lack of preparation. I want to give them, the nurses and the doctors, the numbers, and it's a lot of research. I want to, because as I said before, all over the world, this has to be known as a serious topic. And second, I would see what kind of resources they have, and from their work. And as we said, sometimes they might be able to use the internet. If they cannot, we can adjust it to see what can we do from this content in this setting. Maybe is it better here to have cartoons or printed material to give them, or is it better to have downloads, or we can do some DVDs or whatever they have. But I think that's flexible. And so I think it's the most important is to be aware of the importance of prepare kids. And now we have a really good content on the web, which can be used in different settings.
Yeah, that's really great. And I like that concept of contextualizing it for use and making sure that you do your pre-assessment beforehand on what really obtains using data. So in that line of data, one of our audience asked that, some people might argue, and I think this is from like a cultural perspective, that, some people might argue that the less the child knows about surgery process, the better. And I think as a parent, I find myself doing that a lot with kids, and that the less scared they will be, because they say ignorance is bliss, right?
And that's one of the biggest lie I can hear, because that's totally, as I said, all I said in my presentation, of course, is evidence-based. And, if you ask children, they want to know. They want to be involved. Even if you have a tough diagnosis, you want to be prepared because it's your body. But the thing is, you have to have people who can explain in an age appropriate way. So that's the thing. I think we have to learn how to talk with 3-year-old kids and 8-year-old kids, and that's a big difference. And that's the knowledge you have to be aware of, because when you're meeting children, you meet them from 0 to 18 years. It's a totally impossible task, because whenever in your life are so much things changing in 18 years. No, that's the thing. So that's a knowledge you have to learn. And first you have to read about it. You have to have a base of how children in different ages develop and how they react to hospitalization. And then again, I said, if you really want to learn, talk with the kids you meet.
Yeah.
If you work in a hospital and meet 10 kids a day, ask each of them one question, and then you'll learn quite a lot in one day.
No, that's really insightful. So following up on that piece, I'm sure you did your research. Did you do a sort of like case control of the intervention to test the impact of this intervention? Like what was some of that feedback you received from people who used it versus those who didn't use it?
Yeah, the ones who used it were way better prepared. It's no doubt. But unfortunately, a lot of the kids, and then I'm talking about kids in general, because I did all my research with kids. I didn't do any research with healthcare stuff. I did it with kids. So all my papers I wrote was based on data from collected with and from kids. So first we saw that if we compare to both kids and parents, if we did a randomized study, for example, where one group could be prepared with web-based information and one with a brochure. And then we asked them a lot of questions because it was the same information in the two information options. But when they came back and we asked them questions, it's such a big difference of what they could answer. And the reason I think behind that is that on a website, you can have so many. I start another way. If you do a brochure, you decide this is going to be said and on this, because you have a limited amount of sites or papers. But if you do a website, you can reach them in so many ways. They can see a cartoon, they can paint, they can read, they can look a video. You affect so many more sentences. And that's how kids learn. Kids learn by interacting, for example. They need to see and they need to do, and they need to have impulses and influences from many perspectives. That's how it comes to learning. And if you compare a web, if you have a different options there and just a brochure, of course they learn easier from a video. I'm not surprised. And that was the same with parents, even though the differences weren't as big as between the kids. But unfortunately, I talk with hundreds of kids doing my research. And what I can say, they are unprepared in general. And they are scared and they want to know more. And many, I did a lot of interviews, and I have to keep my interviews to this protocol, of course. But, when we turned the recorder off, they said, "Oh my God, I'm so relieved after talking to you. Why didn't I know this before?" So it makes me really sad when I think about it, because as a healthcare staff, we don't think we have time to the most important. We just have next. But just giving every family 1 minute on the bedside and saying, "How are you? Are you informed about what's going to happen? Or how do you feel? Do you want me to say anything?" But we don't take that time in general. And
Sure.
so I think for me, it's so easy, but you have to be aware of the problem.
Sure. But in terms of, you already shared a lot of interesting details that you learned through your interactions with children. So what other areas through your interactions with the children surprised you during the development of the Anesthesia web?
What's in your interaction with what surprised you? I see the question. What surprised me most? How fun it is to work with kids, and also how little I knew about the things I work with for 25 years. How much they learn me, and also how good it can be when you work together with them. I love working with kids, and we have had all from pizza nights on the balcony to, I know we have a lot of sessions going on, and we also on the website, I worked with a teenager group who have recorded a lot of pods you can listen to, and that's also really exciting, because I remember one boy, he said, I'm interested on how are you laying on an operating table. And I was thinking, this is strange. I want to see how does it look in an operating room, and how do you position people on the table. And he continued, I want to talk with someone. I want to make a pod about how laying people on the, and I said, we can make a pod of that. And he said, yeah, I want to know that, because if you have a tumor in the lung, how would that operation look like? How would the position be? And, it took 4 or 5 months. And then he said, my sister almost died in a tumor in the lung. And so many things like that came up during the work with the kids. So this kind of process for the kids working too with the web. And one thing we have just recently filmed, but it's not on the website yet. But we have taken children in 4 groups into operating room for 5 years, 4 to 6 years, and then this start school years, and then 10, 12, and then teenagers. Groups of 4 or 5. And in the room, it was one OR nurse and a dress table, and it looks like it's going to be an operation. And we have an anesthesiologist and all these things. And then we just filmed the kids when they enter the room to explore the room. So we said, you can do whatever you want. You can look in the drawers, you can touch everything, and you can ask about everything. And you know what you learn there, because you see what they look at. And that's quite good questions they ask. And because they see so many other things than we see.
Sure.
And they see everything.
Yeah.
They smell things and they remember.
Yeah.
And as one kid once said to me, and I said, you're not going to be afraid, because I'm going to be with you all the time. And then he was 11. He said, and how am I going to believe in you? Because the doctor said that after I'm having the cream, so not the IV needle would pain, but it was a pain anyway. And then you said, I'm going to sleep. How am I going to believe you when he said something that was wrong? So, distrust is easily spread to other areas.
Absolutely.
And it's hard to repair, because you have the gift of the child's trust you're given once or maybe twice, but it's very, very easy to lose, and it's hard to regain. So you have to be aware of what you're doing with them.
Yeah.
What you just shared, Gunilla, for me as a parent is really touching, because you said you get the opportunity your child starts out trusting you just by instinct. But then, like you've just said now, that you have that possibility to either gain or lose the trust, and maybe you get a do-over once or twice. I think that's really powerful for us, as parents and aspiring parents. Speaking of technology, you had mentioned, which I think is a lot of parents' worst nightmare, at least for people raising kids in this generation, about technology. And when you showed the stats of, technology use, and I know this is from a resource country setting, but I think the values and the figures would be likened to, even resource limited settings. You said 90, teenagers spend as much as 98% of their time on the internet. And that's powerful, I think, for a parent to know. But then I think flipping the script is, we might as well use that time that our children are spending on the net wisely by using web-based technology to prepare them for health services and, just making sure that you're preparing them. Along the lines with your research, did you find out that children now indicated an interest in pursuing a career in healthcare after they were part of this study?
I cannot say that actually. Yeah, I can say it since early days, 2006. Yes, they are.
Okay.
Yeah.
Okay.
We have actually one in in a med school and 2, 3 nurses. Yeah, so we actually have. Yeah.
Okay.
Wow.
Well,
but not from this recent. It was from 2006, and then we built it in Flash, so that's why we have to rebuild it now. So, but now the site is available on all digital devices.
Okay. Well,
But I was also thinking in international perspective, when we have organizations working, or if we are out working in outcome settings, I think it's easy to think that, this child is going to have a surgery, so that's the priority. Yes, of course it is. But we can do both. We can give the child a surgery, and we can also prepare, because the study is not done internationally how kids are suffering after a year after taking care of, because it can be, my perspective is that it can be quite rough how they are anesthetized in different countries. So I think this message about treating kids good preoperatively and perioperatively, it's very, very important to go out with internationally, because it's not the opposite for giving them the surgery. It's you can do both, but you have to be aware of it, even if you're in India or Africa. I have seen so many kids just taken with a mask on and screaming all over the world with many different organizations. And when I try to say, and I have done it many times. But so I think we have a big work to do there in the international settings to implement this kind of thinking.
You know, it's interesting you mentioned that you've actually done it, because listening to you, I was like, oh wow, I remember during my training years where there was this joke or this term that was used in the local parlance. And for anybody who is watching who may be trained with me or so, we called it akimole anesthesia. So basically you just hold the child down, do your procedure, and then you think they forget about it. But you know, now I'm thinking back is nobody might have, hopefully people are studying that now, the long-term impact.
No, they are not. I can
process.
promise you, it's not done, and it's not even done. You know, in our parts of the world, there are some studies done, but we are about to start new studies in that, because I'm really interested in. It's done up to it's 1 or 2 studies done up to 1 year, and most of them are done in America. And but I think we affect the kids more than we think or want to know. So I want to know how preparation is affecting children in a long term.
Now, so leading up to that, when we had asked about how you set this up, you talked about funding, you talked about technology, you talked about expertise. What would you tell a minister of health in a country, maybe somewhere in Southeast Asia or Sub-Saharan Africa, who says, well, this is great, but it's going to cost me XYZ to set up this platform? How would you advocate for, how would you basically articulate the risk cost benefit for this intervention?
I would like to say that, yes, come on, I want to take you to the OR table now without any preparation. Come on. Why are you afraid? No, of course, because I think it's just easy. The easiest way is just go to yourself. You're about to go into a hospital. Of course, you want to know what you are going to go through. Everyone. And that's included children. But they need to know it in a way which they can interpret and understand. And for me, that's an international right to, it's 2021 and we have the tools. Why can we say no to use them? And also, if you have someone out there, like as you said, someone who's going to invest money, then I'm going to say, but you don't have to invest the money. You can use the anesthesia web. It's already there. And it's cheaper for you. But of course, but if you're going to do it in a big perspective, of course, you have to do it evidence-based.
Yeah.
Because we cannot we cannot say no to the numbers. But what I also think it's so important is that we as adults have to understand that as soon as you're getting adult, you can't interpret a child's perspective. You have to work there with them, and many kids, we know that. I know it also from a clinical evidence that too many kids are afraid and scared coming.
Right.
Yeah.
Right.
And I know I can say it with almost 30 years of experiences 27 in the OR room. So I cannot say it's not existing, and we know it also in papers. So that's the reality. But what is surprising is that it's still going on, that it's not changing.
Sure.
And I think it is a big part of the healthcare perspective's understanding of the problem existing. So for me, you have to be fasting. You can't eat before anesthesia. You have to have a mark where you're going to be operated, and you have to be prepared. I think it's on the same level. It's going to be on a checklist. Are you prepared and understand what you're going to go through? Yes. You haven't been prepared. Sorry, we can't operate you today because you have to wait until tomorrow. Go home and prepare, because we know the long-term consequences. And I want to have preparation up on that level of seriousity.
That's actually interesting that you said to include all of this pre-surgery preparation as part of your checklist. And I know, some people would argue again back to resource limited settings where maybe people have traveled miles just to get access to care and they've been on a wait list. What is the risk of them being taken?
Of course, it's difficult to compare our countries and other, but at least if you have it in your mindset, that's the most important thing with everything I think here, and with this talk or with web-based. The most important thing is that you understand the importance of having children prepared. In one or other way, but having them prepared. And if you meet them and they are scared and not prepared, don't just grab them and put the mask and they are no, take 5 minutes and sit down with them. Because we always have this time, and I hate the kids screaming under a mask and 3 people holding them. And I want to see the numbers of their condition after 1 year, but no one has measured that. And as I said, I understand that sometimes you have to like hold them, but not as many times as it is done, because it can be a mix.
Well, you've definitely given us a lot to think about. Like I said, somebody who has also experienced, surgery, medical care overall, in a healthcare setting, I can definitely attest to all that you've said. I just want to touch on this last question before I hand over to you, Ashwin. We're in the era of COVID, so we have to mention how COVID has an impact on just basically using web-based technology for patient-centered care. Some might argue that with the rise in virtual trainings and telehealth, it should support it. But then I think the flip side of it is, do you think COVID has had an impact on preparing patients for, surgery, anesthesia, healthcare in general?
Absolutely. Because in my hospital, kids are not even called to the hospital before, as of today, due to COVID. They are called in the same morning. Before, they were always called to have a talk with the anesthesiologist, and that sometimes ahead if it was a scheduled surgery, but now they are called the same morning. So no one is prepared ahead. No one have talked to an anesthesiologist before they see them on the morning, and that's not the right time to prepare a kid, neither a parent, on the side or on the side of the bed on the way to the OR. So there, I think web-based preparation have a big role to a big gap to fill, I would say.
This
especially in this time. I think no one comes to the hospital to be prepared before, because they can't in this COVID time. You have to reduce the time in the hospital. And also, as you say, all over the world, the kind of surgery is going to more and more day surgery, ambulatory surgery, or what you call it. And because, that's cheapest for the hospital. You want the kids to come in as close as possible to the surgery, and you want them to leave as soon as possible. And that's another problem, because I don't say that's right to be there more than you need, but at least before, if you stayed one night, you had someone to ask, because, as soon as you wake up today and you're just going out, you have an ice cream and then you go to the bathroom and then bye-bye. And who's going to ask all your questions? I think then also here, web-based information can be a really good support.
Absolutely. Well, it has been an illuminating conversation, Gunilla, and we have more questions, but I'm sure even the audience members have a lot more questions, and because it's just such a captivating study and such an important study at an important moment of time. And in terms of contacting you, what are some social media handles people can reach out to you? And you have information not only for the general public, but also for multiple stakeholders, whether it is healthcare agencies, multilateral organizations who might be willing to incorporate this within their own health systems, checklists. What are some social media handles people can reach out to you?
The anesthesia, on the anesthesia web, you have the mail address.
Okay.
mail@anesthesiaweb.org. I'm reading the mail, so just send me an email. And you can also, if I can ask you all to just help me spread the message about the anesthesia web. We are, you can, as I said, share the link as much as you want. And also we are of course, on Facebook. We have an English site on Facebook, Anesthesia Web. And also on Instagram. So we are there. So, from one to another, I think we can help spread a message all over the world because it's free. Just use it. And it's available. And the only thing we in the Dream Team want is it to be shared and used to help the kids.
So to the people, parents, healthcare workers, and everyone watching this show, please explore anesthesiaweb.org. The link has been posted in the description box below, and please help spread the message. This is important not only for healthcare and public health in general, but for the next generation. Over to you.
And note that the anesthesia is A-E-N-A-E, anesthesia. It's a European spelling, but we are Europeans from there. So we just have to choose. And actually the anesthesia, the American spelling way was not free, the domain, the web domain. So that's anesthesiaweb.org, yes.
Yep. Well, I would say not just Europe, but the rest of the world will spell anesthesia that way. So as Ashwin said, it has been a pleasure speaking with you. We've had so many audience, interactions, questions, and even I myself have learned a lot, especially as I reflect back on my experiences and also, just being a parent. For our audience, thank you so much for staying up. I know we're past the hour, but we appreciate your patience. We appreciate your engagement. And please like and subscribe our channel, where we bring awesome people like Gunilla to talk about healthcare interventions. Please send us feedback on topics you would like us to address. And we're actually looking for, experts in their field to also come and share like different interventions, technologies, innovations that they've developed. So please, just feel free to reach out to us, subscribe to our channel, reach out, explore anesthesiaweb.org. So Gunilla, all I'll just tell you is tack så mycket.
Varsågod. Welcome back to Stockholm, and you, Ashwin. And I'm just an email away. So just let me know if you have questions. Yeah. And also, if you work internationally and through an organization or any hospital or whatever you're working, and you see a chance to have a benefit from this site, just let me know.
You will.
I am here to help.
Yeah, wait, I'm reading some audience comments here. Thank you for sharing on behalf of acupuncture and Chinese medicine field. I guess this is applicable. Somebody said, wash hands, wash hands, wash hands. I guess we're in COVID era. So we want to make sure we're all being safe so that we curb the spread of the virus and we can come visit you again in Stockholm, Gunilla.
Yeah.
Once again, thank you, everyone. Please stay safe, be well, and
have a good
we will
day
talk to you
wherever
again
you
soon.
are.
Yeah.
Thank you.
Thank
Bye-bye.
you.
Bye, everyone.
Bye-bye.